So this is actually research done by me in Georgia, in University of Georgia. The title of the research is the relationship between solution-focused therapy, basic needs deprivation, and depressive symptoms. It was a case study of six people diagnosed with severe to very severe depression, and it was studied for my master clinical psychology master degree. So let's just jump into a little bit about me. I'm from Eastern European country, Georgia, and clinical psychologist, as I have told you. And I'm one of the so I admit, I'm one of the lucky ones to get to introduce to solution focused approach by Chris and Ivan. If you're familiar with them, they're from UK, and they were kind enough to support our training and guide us through this process. And with their help, we have established. So we have established a solution-focused brief therapy here in Georgia. We are a small six group of people, and we try to make it more and more popular in Georgia. So let's start with the abstract of the research. So this was a case study about relationship between depression and basic needs deprivation, while evaluating how solution-focused approach might be used in terms of depression. So for people to be chosen for this research, they have to meet criteria on a PHQ-9 scale for depression. So PHQ-9 scale is the questionnaire for depressive symptoms, and I will get to that in the next slides. I have also used the basic needs scale, which is from choice theory, another therapeutic approach actually, used by Glasser, William Glasser, who was the American psychiatrist. In this therapeutic approach, I have used two therapeutic models of solution-focused approach. One is Chris Ibsen's solution-focused art gallery model, and another was the class model by Hedgert. In terms of selection, there was people ranged from age of 19 to 15, and they had to meet PHQ-9 criteria, scale above 15. So scale above 15 is severe to very severe depression. This is all the criteria that the PHQ-9 scale covers from depressive symptoms. So it is loss of interest and decreased pleasure, mood swings, changing in sleep patterns, decreased energy, appetite change, decreased self-esteem, and difficulties in concentration, slowing movement and speech, and suicidal thoughts. In terms of basic needs scale, and I will ask question, are you familiar with basic needs scale? Any of you? Okay. Little bit.
Somewhat, yeah.
Yeah, maybe you're more familiar with the Maslow pyramid of basic needs,
Yeah.
right? It is similar, but a little bit different. So there are five basic needs from this theory. Survival and safety is number one because it directs all the behavior. Then there is love and belonging, power and control, freedom, and fun and entertainment. So this was a 10-point scale, and we have to assess if there was any deficits in terms of basic needs and how they are fulfilled with people in depression. So these are the objectives of the research, which has four objectives. First one was to describe the relationship between lack of basic needs and the depressive symptoms. Second one is to describe how the basic needs scale score and depression symptoms will change after five sessions of solution-focused brief therapy. So it was only 5 sessions, which is really not that much in terms of severe to very severe depression. And we knew that it was not really end of depression after 5 sessions, but we wanted to see how it will change the symptoms and the scales. Third objective is to determine the effectiveness of solution-focused approach and dynamic of depression. And fourth one is to identify effective strategies and methodology to overcome depression. So in research, we have had three hypotheses. One was people with depressive symptoms experience lack of more than one, or at least one, basic needs. The second one was after 5 sessions of solution-focused brief therapy, depressive score will be decreased. And the third one was after therapeutic intervention, symptoms of depression decreases. And it also should have had effect on basic needs. So if you're not familiar with solution-focused approach, this is a good slide for you because this one was the typical session used in solution-focused approach. As you might know, solution-focused approach does not really cover problem, sometimes not at all. Here we have covered problems only 5 to 10 minutes, usually using the scale. So PHQ-9 scale was mainly how we covered the problem. And we have some brief discussion about it only on the first session. And it was also used to establish rapport with the clients. The second one was to define significance and personal meaning. So for people, all the feelings and all the activities are personal to them. So we have to just know what it means for them personally. Then we established the best exceptions and from this therapy. So what they are looking forward to get from us as a counselors. And another one was to define desired future and goals. So what they wanted. We knew that they wanted to get rid of depression, but the question was what they wanted, if not depression. So what they wanted instead of depression to say. To identify coping strategies. And if you're familiar with miracle question, we used the miracle question in a very interesting way, and we will discuss it later. And then there was scaling and positive feedback and in between session tasks. So in between session task is something that some solution-focused approach practitioners use and some don't, but I think that in terms of depression, having in between task is important for, let's say, behavioral activation. So people might do something they tend to avoid. Okay. So in summary of the cases, as I mentioned, we have 6 cases. 3 of them was in person and 3 of them was online. There was no significant difference between clinical and face-to-face and online sessions. So in terms of depression, we can say that both face-to-face and online counseling works the same way. According to depression scale score, we have started the depression scale 15 to 90 points in each cases, or there was 20 to 27 in each cases. And in all the 6 cases, we can say that depression was average or minimal. So it was below 11 points in all the 6 cases. In terms of basic needs scale, we can say that there was 2 basic needs deprivation that was really significant. It was survival and safety needs, and lack of interest, lack of entertainment. So this was 2 needs. In terms of survival and safety, people mentioned that they were they mentioned living environment and current events. So in Georgia at the time, there was a massive protests and political situation was really bad to say. So that really had impact to our clients, and that's why I think they mentioned that first one. The second one was physical and physiological conditions. So most of people felt depressed since they were young. So that's why they mentioned this. In terms of fun and entertainment, most people said that they meant by fun and entertainment various types of activities, which was walking, reading books, exercising, watching a movie, taking care of themselves, making food, waking up early, and the socializing parts was also mentioned. So what was helpful? This was one of the objectives of research. In terms of being helpful in between session tasks, and the miracle question was the most helpful things that we have observed in these five sessions. Miracle question just gave us all the activities that we needed to direct people towards new beginnings or new activities that they might try on. And this is a seven things that was most helpful for people suffering from depression, which is really minor things. Like you might say that how could this help? But this was really small and tiny changes that led to bigger changes overall. And so first one was physical activity, which all the participants mentioned that was helpful for them. Second was waking up early in the morning. So most of them woke up after 12 or 1 p.m. So it was something that they changed a little bit, little by little. So it was like 11 or 10 p.m., 10 a.m. And it has really significant effect on their life overall. Third one was preparing and serving breakfast in peace. So most of our case study participants just skipped breakfast because they were getting up really late, and all of them was working. So they just went to work as soon as they woke up in a hurry. So having a peaceful breakfast in the morning was something that really also helped them. First one was mental activities like learning new things or reading books. First one was spending quality time in environment with their, let's say, colleagues or friends or so sixth one was the socializing part, which also links to the fifth one. It's spending time with friends, mostly after their work or of their family members, because they did not really have that much time with their family members. And seven ones was allocate more time, more free time for them to care for themselves. Um, So finally, regarding hypotheses, we can say that all three hypotheses were confirmed in all six cases of severe and very severe depression. A number of deficits. There was a number of basic need deficits, more than one. After five sessions of solution-focused approach, most of the cases, not most, but all of these cases was had a positive dynamic overall. And there was also significant difference in terms of eliminating basic needs. So basic needs also had really good impact on the depressive scale. So this is my favorite quote from a solution focused approach team, uh, which you can access later. So these are some recommendations for people who are working with depression, usually severe depression. And this is our recommendations. So first one would be to focus on the future, not on the problem, because people with suffering with depression tends to stay in past and are more of a nostalgic or tends to not having any hope for the future. So this is when miracle question comes really handy. Because you have to just imagine your future without problem, and it is really hard for them to do that. So there are some ways we can work over it. So yeah, another recommendation would be to have a clearly identify and leverage current resources and strengths. So even though people cannot really come up to the idea what the strengths and resources they have, they would typically just say, I don't know, or I don't have any resources or any strengths, or I am not really dealing with depression really well. And this is a typical answer. But after some sessions, mostly after second sessions, they would open up and could come up to the really good ideas. One of the most, let's say, useful was to focus on behavioral. And it might be similar to cognitive behavioral therapy, where you might notice behavioral activation. It's what's called in CBT. It's somewhat same, but a little bit different because we use it with a scaling question. So it's just stop it. Okay, stop sharing, and I want to it be interactive and Q&A. So I will just answer questions if you have, and I will reshare a presentation if you have missed some parts for people who joined a little bit later.